What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. One of the first goals in a rehabilitation program is structure stabilization. And when I think of structure stabilization, I look at it from a couple different standpoints. First, there is an anatomic structure point of view, meaning that something is broken, something is torn, something is partially torn, something is loose. So it's really about the primary inherent structure. So ACL tears, ligamentous tears, broken bones, that sort of thing. The secondary aspect of structure stabilization is the supporting tissue and musculature around the injured structure. Sometimes the primary structure is, I guess by definition, the primary structure is the main stabilizer of that particular region, but there are secondary structures, namely the surrounding musculature, the tendons, the ligaments around it that also can support that area that has been injured. So stabilization for me is partly anatomic, and also the surrounding tissue that helps support the function of that particular area. The last aspect of structure stabilization is how provocable or irritable the symptoms are of that area. And that's not always pain. It's sometimes stability. So in the context of, pain is obviously a very big limiting factor. If someone has a painful, let's say leg or ankle, there's a good chance that stability is going to be, or the ability for that structure to support the weight of the individual is going to be compromised. Similarly, I have had some patients experience almost no pain symptoms with most steps, and then it can go from like 0 to 100 with a misstep or change of direction. So you have, let's say activities of daily living, just walking around, and the pain is not a limiting factor, but then all of a sudden they do a particular movement or activity, and even though it may be lasting seconds, the pain is so severe that they have lost the primary function of that particular limb. Now, the same concept can be used with stability. Sometimes the stability is present all the time, and sometimes it's with certain activities, and it can also be very unpredictable, which from my standpoint is actually the worst kind of issue. But I wanted to kind of lay out these kind of parameters of how I look at stabilization, because it is a very kind of vague term, but this is the way that I personally understand it and relate structure stabilization to my patients. Stabilization can come in one of two ways. One is through natural history or natural healing, or surgery. I'm going to talk a little bit more about the natural history. When it comes to partial tears or sometimes even just general bruising of a structure, time will usually heal most things, and it doesn't necessarily mean that things have to be perfect, but the body's inherent ability to heal injured tissue does take time. Now, there is a role for regenerative or augmentation of natural history, and that's the introduction of loading tissue to cause what's called mechanotherapy, where loading tissues will trigger the inherent regenerative abilities of the body. And that can be through massage, physical therapy, and other types of manual treatments. There's also the role of biologics. So biologics meaning the platelet-rich plasma, stem cell therapies, things like that. When it comes to biologics, I really try to emphasize that it is a triggering of normal healing. And usually the target of biologics is for tissue that has poorly healed or never really healed itself. And the idea behind the biologic is to introduce a trigger for natural healing. And when I mean natural healing, that means at the normal rate. So biologics don't necessarily speed up tissue, but they might trigger things to occur, but at a normal healing rate. And structure stabilization is important not only from a pain standpoint, but also trying to load the tissue. When a structure is unstable, obviously it can be hard to build anything off of that. But the loading of this type of tissue is also different. Now, there has to be a distinction made between loading healing tissue versus loading normal tissue. You can almost think of it as a scab of a healing wound. You can do normal things, but sometimes if you load the tissue too much, it can peel the scab, or it can make it bleed, or sometimes it can just eventually form a scar because of delayed healing. So stabilizing the structure and also loading the tissue at the same time is part of the rehabilitation process. Now, surgery, definitely has a role. As a non-surgical specialist, obviously I try to maximize someone's function without the need of surgery, but honestly, sometimes surgery is where things need to start. There is, outside of, a very catastrophic injury, most injuries can be healed, or at least the rehabilitation process can be started without surgery. That can sometimes be difficult for patients to accept. Conceptually, if a structure is injured or damaged in their mind, some people just kind of are focused on that, well, I can't get back to what I need to do until things are tied back together or the bone has been healed. So they kind of elect to not do anything until they don't feel any pain in that area, or they also don't want to participate in any rehabilitation activities because surgery is the only thing that they can focus on. Initially, that was a little bit of a source of frustration for me because, trying to convince someone, that, they can move even though they don't need surgery, it can be challenging, especially in a very, very short visit. But with time and experience, I've started to, I think, understand my patient's perspective a little bit better. And I will sometimes just refer them to talk to a surgeon, because ultimately, if that's really what they're focused on, sometimes they just need to hear it from them that, hey, I think you are a surgical candidate versus you're not a surgical candidate. And earlier in my career, I almost thought it was my role to try and keep people away from unnecessary surgeries at all costs. But ultimately, we all want what we want, and even though I think a patient is going to do well with a non-surgical treatment plan, if they want to talk to a surgeon, I think it is a disservice to not allow them to actually be seen. Sometimes they just want their perspective and their opinion, and who am I to stand in the way of that? So, overall, structure stabilization is very important. Sometimes going through natural history and natural healing is the first step. Sometimes surgery is the first step. But understanding your patient's needs and wants, I think, is first and foremost. It doesn't make a lot of sense to refer someone for conservative management when they adamantly say that they don't think that this is going to help. I don't think it's our job to convince people that it is going to help if they are really, kind of just set on believing what they want to believe. It is really very hard to change people's minds when they're just so focused on that. So I've kind of adopted the stance of, like if this is what you think you need, then maybe you need to go talk with a surgeon and then you guys can have a discussion. Because if the surgeon's views and your views align, the chances of your outcome are going to be pretty good. If I force my patients into what I think is best and they disagree, the chances are that the outcome are not going to be very good. And as a physician, we all just want, patients to be happy with their outcome. And sometimes that means you have to align them with the right people. But anyhow, I wanted to talk about the importance and the value of structure stabilization just from a conceptual standpoint, and I hope you found this to be helpful. Take care. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.